If you have lower back pain or sciatica from stenosis, degenerative disc, or arthritis, you're in the right place. These exercises can eliminate it completely. I'm Dr. Jared, and when we say stenosis, that simply means a narrowing of a canal or channel. In our lower back, it happens in two places. It happens out here on the side where our nerve roots exit, or it happens in the middle as the spinal cord runs up and down. Typically, extension activities like standing, walking, or even bending over backwards make this problem worse because it narrows those holes. Whereas flexion activities such as sitting and rounding our spine forward put our back in a better position, it's more open back there, and typically causes a lot of relief to your pain. So this problem is best treated as we do stretches that are going to open up your back and open up those canals, and then strengthening exercises so that we stabilize them and keep them in that healthy, pain-free position. These are the best exercises to do it. Let's start by creating a little more space in your lower back. These are 3 of the best stretches to do it. Go ahead and lie down on your back with a slight bend in your knees. Now what we want to do is stretch the glute out. In order to do that, I'm going to grab one knee and pull it right here into my chest. We call this one a single knee to chest stretch. And so I'm going to do this until I get a good stretch kind of in the high hamstring and into the glute area. You'll probably even sneak up into that lower back as you pull and as your pelvis rocks backwards. And so we're going to hold this in a comfortable position for about 20 seconds and repeat that 3 times. It is important to note that if you do have some knee pain going on and we don't like this pressure on top, you can always come right here behind your knee. The objective is to pull the knee up as high as you can until we get a good stretch down here through the glute. So again, 3 times 20 seconds, and we repeat that on both sides. If that one feels good, I like to show people the double knee to chest version of this, in which case we're just going to bring both knees up towards the chest and then pull them both in just like this. And the thing that I really like about that is as I pull both knees up, my tailbone can actually lift up towards the ceiling. And that I know I'm getting some more flexion into that lower back. I'm getting some more opening of those canals if I can pull into that position. And the same parameter would apply here, 3 times 20 seconds. Next, let's get into a piriformis stretch. And to do this, this is just kind of a slight variation on that first one that I showed you. And so the beginner version of this would be grabbing the knee, and instead of bringing it straight into my same shoulder, I'm going to take that knee over towards my opposite shoulder until I get more of a stretch through kind of the outside part of my glute. And so again, that's kind of stage 1. You're going to feel that in that area. That's a good place to start. 3 times 20-second holds on both sides. But if you can, what I like, the more aggressive version, would be to actually cross your legs. So I'm crossing right now my left leg over my right knee. Now with my hands, I'm going to grab right here behind my right knee and then pull that right knee up towards my chest. And you just feel a much more significant stretch in that muscle and in that piriformis area as you do this. And so 3 times 20 seconds on both sides if you can handle that one. And then finally, the last thing that we want to do is stretch out your hip flexors. And if your hip flexors are tight, they're actually pulling on your lower back all day, pulling it into this extended position. So if we can get those to release and relax, you start to feel a lot better. This is how we do it. You're going to kneel in a tall kneel position. So I'm going to start by stretching my right hip flexor. My right knee is down on the ground. My left leg is bent like this here in front of me. Now I'm going to maintain good posture as I slowly put weight onto this front foot. I'm putting weight onto my left foot until I get a really good stretch right here through the front part of my hip. It also helps if you can even contract this glute back here. That will keep your hips and your pelvis in a better position. So we squeeze this glute, and then as you lean forward, that's really going to accentuate that hip flexor stretch right here in the front. And on that, 20 seconds repeated 3 times on both sides. Hey, did you try the stretches so far? And how is your lower back feeling? I would love to hear from you. Leave me a comment down below. Hit the thumbs up button if you've gotten some relief from this video so far, and thank you for doing that. Also, I have to tell you about our new membership program here in Tone and Tighten. You can get bonus content from me. It's a chance to support the channel. Hit join down below to learn more about that, and thank you so much for checking that out. Okay, now that your back is stretched out and those vertebrae are in the right position, we need to strengthen your core and stabilize in that position to keep you out of pain. And here are 4 of the best core exercises to help you to do that. Go ahead and lie down on your back. We're going to start with some posterior pelvic tilts. Now in this position, you might have an arch underneath your back. We would refer to that as an anterior tilt in your pelvis. What I want you to do is use your core muscles to pull your back down towards the floor, pull the front of your pelvis up towards your belly button. As you flatten that back into the ground, try to activate that deep core layer, those deepest core muscles. You can do that by drawing your belly button in towards your spine. And so to repeat that in real time, right now I have an arch underneath my back. I'm going to use my core muscles to pull my back down to the floor and then pull my belly button into my spine. I'm going to hold that for about 3 to 5 seconds and then reset and perform that again. And I would do about 3 sets of 10 reps. That's a great place to start. That's just going to put your back in that healthier position. But now what we can do is build on that. And so exercise number 2 would be that same posterior pelvic tilt, but now we're going to add some marches to it to make things a little bit harder. And so the setup's the same. I'm going to flatten my back. I'm going to tighten my tummy. I'm going to hold that in this nice tight position as I lift my left leg up off of the ground and then lift my right leg up off of the ground. And then what we can do is reset the system. So flatten that back, pull the belly button in, tighten those tummy muscles up, and then march left, march right, and then we can reset. If you don't need to reset each time, what we can do is just hold that position and then march, and we can keep marching. And what I'd recommend here is 10 marches on each leg, and we repeat that 3 times. But keep in mind, the marching isn't the important part, it's the bracing in the core. That's what we're after, so make sure you hold that. Exercise number 3 would be a bridging exercise. Now we're going to kick on the spinal erectors, but we don't want to do this in such a way that we aggravate the back. And so if I just do a bridge, you can see that I can do that and I can really arch my back. And again, we know that that's not the best position for the back to be in. So what I want is to do a posterior pelvic tilt. So I'm going to flatten my back down and then tighten my tummy and then hold this position as I just lift my hips up a couple inches off of the floor. So I'm not doing this big arch in my lower back, but I am still activating those glutes and those spinal erectors. And so flatten the back, tighten the tummy, hold that position as we contract the glutes, fill that in the lower back, hold 1, 2, 3, and then come back down to that starting position. 3 sets of about 10 to 15 reps is a great number to shoot for. And then finally, the last thing that I like to do would be a bird dog exercise. For this one, we're going to get down on all fours, this position right here. I want you to find a neutral position for your back. So my back's not super arched this way, but it's not super arched this way either. It's in this nice neutral position. Now what I want to do is extend my right leg back behind me as my left arm reaches forward, trying to maintain this nice neutral spine and this nice stable core. Hold 1, 2, 3, and then come back, and we're going to repeat that on the other side as well. Typically, if you lift your leg up too high, you're going to get that more into your lower back. And so if we need to keep that leg nice and low, especially to start, that's a great option to do that. And so 3 sets of about 10 reaches on both sides is what I typically recommend. Hope these help your back to feel better, and thank you so much for watching.